Dear friend, have you ever wondered how the smallest things in life can carry the greatest mysteries? Today, I want to share with you a remarkable story that unfolded in Columbus, Ohio. A story about a young man named Ryan Mitchell, whose life was forever changed by something so tiny, so unexpected, that even his doctors couldn't believe their eyes. This isn't just another medical tale. It's about how our bodies sometimes harbor secrets we never knew existed. It's about the price of pride, the cost of fear, and ultimately, the miracle of discovery that can emerge from our darkest moments. What Ryan's surgeons found that day in the operating room would not only save his life, but would also connect him to a past he'd completely forgotten. So settle in, and let me tell you about the day everything changed. The surgical lights blazed overhead like miniature suns as Ryan Mitchell gripped the edges of the gurney. His knuckles had turned white, matching the sterile sheets beneath him. 5 years. 5 long years he'd carried this burden on his face. And now, finally, it would end. Ryan, I need you to count backward from 10 for me, the anesthesiologist said gently, adjusting the mask over his face. But Dr. Marcus Webb wasn't looking at the monitors. He was staring at the MRI scan, his brow furrowed deep enough to cast shadows. 20 years of facial surgery. And something about this case felt wrong. Hold on, Dr. Webb said suddenly. Don't put him under yet. The medical team froze. Ryan's eyes flew open, wide with alarm. What's wrong? Ryan's voice came out, muffled through the mask. Dr. Webb approached the gurney, holding the scan up to the light. Ryan, you said this started with a basketball injury 5 years ago. Yes, sir. My friend Jake elbowed me in the face. It swelled up and never went away. The surgeon traced his finger along a bright spot on the scan. There's something metallic in there, dense, but that's not the concerning part. He paused, choosing his words carefully. There's a second foreign object, much older, much deeper. Ryan's mother, Linda, who'd been allowed in the prep room, stood up so fast her purse clattered to the floor. What do you mean, older? Mrs. Mitchell, has Ryan ever had facial surgery before? Any accidents as a child? Linda's face had gone pale as parchment. No, Wait. Her hand flew to her mouth. Oh, my Lord, I'd forgotten completely. The room seemed to hold its breath. Even the heart monitor's beeping seemed to slow. Mom. Ryan turned his head. The tumor on his left cheek catching the light, purple-red, the size of a golf ball, with visible blood vessels threading through it like tiny rivers. What did you forget? Linda sank back into her chair. Tommy Henderson, the boy next door. You were 10, playing in the backyard. Her voice trailed off. Dr. Webb set down the scan. Mrs. Mitchell, I need to know exactly what happened. Tommy had gotten a pellet gun for his birthday. His parents weren't home. You boys were playing cowboys and... Linda's eyes filled with tears. He shot you. Ryan, right in the cheek. The emergency room doctor said the pellet was lodged too deep, that it was safer to leave it than try to remove it. You were so young, and after a few months, we all just forgot about it. Ryan's hand instinctively moved toward his cheek, but the nurse gently stopped him. I was shot, and nobody told me. You were traumatized, Linda whispered. You had nightmares for months. The counselor said it was better if you forgot, and you did. We all did. Dr. Webb picked up the scan again, studying it with new intensity. This changes everything. The pellet appears to have created a pocket of scar tissue. When your friend hit you 5 years ago, it likely introduced new foreign material into that same area. creating a perfect storm of inflammation and infection. New foreign material? Ryan asked. The scan shows what appears to be glass fragments. 3 distinct pieces. Ryan's mind raced back to that day on the basketball court. Jake's expensive sunglasses shattering against his face, the sharp pain he'd dismissed, the blood he'd wiped away with his sleeve. But here's what concerns me most, Dr. Webb continued, his voice dropping. The tissue around that old pellet. It's showing signs of dysplasia, precancerous changes. If we hadn't found this now, The unfinished sentence hung in the air like a sword. Are you saying, Ryan whispered, that Jake hitting me in the face actually saved my life? Dr. Webb nodded slowly. The injury that created this tumor led us to discover something that could have killed you in a few years. Sometimes, Ryan, our bodies keep secrets even from ourselves. The surgeon turned to his team. Prep for a complex extraction. We're removing everything, the tumor, the glass, and a 15-year-old pellet. He looked back at Ryan. This is going to be more complicated than we thought. But I promise you, when you wake up, all of this will be behind you. As the anesthesia mask lowered over his face again, Ryan's last thought before the darkness claimed him was of Tommy Henderson, the neighborhood bully who'd shot him 15 years ago. He wondered if Tommy ever knew that his cruelest act might have accidentally planted a tiny guardian angel in Ryan's cheek, a lead pellet that would one day reveal itself just in time to save the life it had once threatened to take. The operating room doors swung shut, and Linda Mitchell stood alone in the hallway, clutching her phone. She scrolled through her contacts until she found a number she hadn't dialed in over a decade. Tommy Henderson. Now Officer Henderson with the Columbus Police Department. He deserved to know that his worst childhood mistake had just become Ryan's unexpected salvation. The surgical lights continued to blaze as Dr. Webb made his first incision, prepared to unravel a mystery 5 years and 15 years in the making. Before we continue, please leave a like and subscribe. Let me know which city you're watching from. Now, let's get back to the story. The scalpel broke through the last layer of tissue, and Dr. Webb's breath caught. The tumor spayed open like rotting fruit, releasing a yellow-gray fluid that pooled in the surgical cavity. The smell hit him through his mask, metallic, sweet, wrong, 20 years of cutting into faces, and this made his stomach clench. "Suction!" he commanded. The nurse's hand moved instantly, the vacuum gurgling as it cleared the field. There, black glass, jagged as a broken tooth, nestled against the facial nerve 1 millimeter to the left, and Ryan would have lost all feeling in his face years ago. Dr. Webb's forceps closed around the largest fragment. It came free with a wet sound that made the resident step back. Oakley, the brand name still visible on the glass, etched in white. "Second piece," Dr. Webb muttered, probing deeper. The tissue had grown around it, pink and angry, blood vessels threading through like desperate fingers trying to wall off the invasion. His hand trembled slightly, not from age or inexperience, but from what he saw beneath. The pellet. It sat there like a tiny metal pearl, innocent-looking, surrounded by tissue that looked different, grainy. The cells under the surgical lights had that particular sheen he'd seen before, the texture that made his pulse quicken. Pre-malignant transformation, more advanced than the MRI had shown. Dr. Webb, the anesthesiologist's voice, cut through his concentration. Heart rate spiking, 110. Well, Ryan's body knew, even unconscious. Some primitive part of his brain recognized the invasion, the extraction of something that had lived inside him for so long it had become part of him. The forceps closed around the pellet. It should have come free easily. Lead shot, smooth, 15 years of scar tissue making a perfect pocket. But it didn't move. Dr. Webb increased pressure. Nothing. Then he saw why. Tiny white threads, almost invisible, had grown from the surrounding tissue into microscopic pits in the pellet's surface. The body had tried to absorb it, to make it part of itself, and in doing so, had started the slow transformation that would have killed Ryan in 3 years, maybe less. "Get me the micro scissors," he said, his voice steady despite the sweat beading on his forehead. "And call pathology. Tell them we need a frozen section now." Because what he saw growing from the opposite side of the pellet wasn't scar tissue. It was something else entirely. Something that shouldn't exist in a 25-year-old's face. Something that looked suspiciously like bone. The micro scissors sliced through the fibrous threads with tiny snicks that Dr. Webb felt more than heard through his instruments. Each cut released a bead of fluid, not blood, not pus, but something clear and viscous that clung to the metal like syrup. "Frozen sections ready in path," the circulating nurse called from the doorway. "They're standing by." De Webb dropped the tissue sample into the specimen container. The nurse sealed it and rushed out, her footsteps squeaking against the polished floor. The clock on the wall read 11:47 a.m. Every second mattered now. The bone, if that's what it was, extended from the pellet like a tiny branch, barely 3 millimeters long but unmistakably organized into what looked like trabecular patterns. Real bone architecture. Growing inside a tumor triggered by a piece of lead that had been sitting dormant for 15 years. "Irrigation," De Webb ordered. Saline flooded the cavity, washing away the debris, revealing more of the structure. His surgical loops magnified everything 4 times, but he wished he had the operating microscope. The tissue around the pellet had taken on a mother-of-pearl sheen, almost beautiful if you didn't know what you were looking at. The monitor above Ryan's head showed steady vitals. Heart rate had settled back to 95, blood pressure holding at 118.7. The young man's chest rose and fell in mechanical rhythm with the ventilator, oblivious to the archaeological dig happening in his face. De Webb's resident, Dr. Sarah Kim, leaned in closer. "Is that heterotopic ossification?" "No." De Webb's forceps probed the edge of the bone fragment. "Oh, looks different. This is organized, structured. Look at the periosteum forming along the edge." The pathology phone rang. Dr. Kim answered, listened, her eyes bending behind her surgical glasses. She covered the receiver. "Preliminary path shows dysplastic cells with osseous differentiation. They want to know if there's more tissue to sample. Tell them to wait." De Webb's hands moved with renewed urgency. The pellet needed to come out, but not at the cost of facial paralysis. The nerve ran so close he could see it pulsing with each heartbeat, a pale yellow thread that controlled every expression Ryan would ever make. He worked the tip of the elevator instrument under the pellet, gently creating a plane of dissection. The bone fragment came with it, still attached, like a tiny white flag. As he lifted, something else became visible in the depths of the wound. Glass. Another piece. Smaller than the others. Embedded directly behind where the pellet had been sitting. This one was different. Not black like the sunglass lens, but clear, with a greenish tint. Window glass? Old window glass. Dr. Webb's mind raced. The basketball injury had driven modern glass into the wound. But this piece, this was older. Much older. "Mrs. Mitchell," he called out, knowing she was sitting just beyond the operating room doors, that the intercom was on. "Was there broken glass when Tommy shot Ryan?" A pause. Then Linda's voice, thin through the speaker. "Yes. Oh, God. Yes. Tommy shot through the garage window. Ryan was on the other side. The pellet went through the glass first. 15 years. A piece of garage window had been sitting in Ryan's face for 15 years, sealed behind the pellet like a time capsule. And when Jake's elbow had driven new glass into the same spot 5 years ago, it had created a perfect storm. Chronic inflammation, infection, and cellular changes that had awakened something that should have stayed sleeping. Dr. Webb extracted the green glass with infinite care. It came free with a soft pop, leaving a cavity that immediately filled with blood, not the bright red of fresh arterial bleeding, but dark, almost purple blood that had been trapped in malformed vessels. More suction, gentle. The cavity cleared, revealing the full extent of what they were dealing with. The tumor wasn't just a reactive mass of inflamed tissue. It had its own architecture, its own blood supply, fed by vessels that branched off the facial artery in patterns that made no anatomical sense. And at the center, where the pellet had been, the tissue was transforming into something that looked increasingly like primitive bone tissue, osteosarcoma, in its earliest stages. "Paths on the line again," Dr. Kim said. "They're recommending wide excision with frozen section margins." De Webb nodded, but his attention was fixed on something else. At the deepest part of the wound, barely visible even with the loops, was a structure that shouldn't exist. A tiny capsule, no bigger than a rice grain, with a smooth, almost polished surface. It pulsed with its own rhythm, independent of Ryan's heartbeat. He touched it with the probe, and it moved, not the passive movement of dead tissue, but an active recoil, like a living thing pulling away from the metal instrument. "What is that?" Dr. Kim breathed. Dr. Webb had seen many things in 20 years of surgery. Tumors that looked like teeth, cysts filled with hair, parasitic infections that defied explanation. But this? "Get me the microforceps, the smallest we have, and prepare a separate specimen container." His voice remained steady, professional, but his pulse hammered in his ears. "Label it unknown tissue for specialized pathology." The capsule seemed to sense his approach. As the forceps descended, its surface rippled, iridescent, under the surgical lights. For one impossible moment, Dr. Webb could have sworn he saw something moving inside it, a shadow, a flutter, like a butterfly wing trapped in amber. The forceps closed around it. The monitors erupted in alarm. Ryan's heart rate shot to 150. His blood pressure spiked. 165/95, punted 98, climbing fast. The anesthesiologist's hands flew over his equipment, adjusting flows, pushing medications. "He's reacting to something," the anesthesiologist said. "It's not surgical stimulation. It's something else." De Webb held the capsule suspended in his forceps, watching it pulse faster now, matching Ryan's racing heartbeat. Whatever this thing was, it had integrated itself into Ryan's autonomic nervous system. It had been living inside him, feeding off him, growing alongside the tumor that had hidden it. "Doctor," Kim whispered, "should we—" The capsule burst. Clear fluid sprayed across Dr. Webb's loops, and for one terrifying second he thought he'd been contaminated with something infectious. But the fluid evaporated instantly, leaving only a faint mineral smell, like hot metal or old pennies. Inside the ruptured capsule, visible now under the surgical lights, was something that made everyone in the room stop breathing. A perfectly preserved human tooth, a baby tooth, small and white, with its root intact. But Ryan had never lost a tooth to trauma. His dental records were clear, which meant this tooth belonged to someone else. The tooth lay in the steel basin like an accusation. De Webb's forceps trembled as he set it down, the tiny click echoing through the silent operating room. "Maintain surgical field," he commanded, his voice cutting through the paralysis that had gripped his team. Dr. Kim, photograph everything, every angle. The camera clicked in rapid succession. Ryan's vitals had stabilized, heart rate dropping back to 105, blood pressure normalizing at 128. His body seemed relieved, as if the capsule had been a burden it had carried too long. Dr. Webb returned to the wound. The cavity where the capsule had been was already filling with normal-looking granulation tissue, pink and healthy. The body was healing itself in real time, faster than should be possible. He probed the edges, looking for more abnormal tissue, more secrets hidden in the architecture of Ryan's face. "Doctor," the pathologist's voice crackled through the intercom, "we need that tooth. The preliminary tissue results are unusual." "Define unusual," Dr. Webb said, continuing to debride the wound margins. "The osseous tissue isn't malignant. It's not even dysplastic anymore. The cells appear to be reverting to normal differentiation patterns. It's as if removing that capsule triggered some kind of healing cascade." Dr. Webb paused, his scalpel hovering over the tissue. In 20 years, he'd never seen cancer cells spontaneously revert. But then again, he'd never found someone else's tooth encapsulated inside a facial tumor either. The intercom clicked on again. Different voice, security. Dr. Webb. "There's a situation in the waiting room. Mrs. Mitchell she needs to speak with you urgently." "I'm in surgery. She says it's about the tooth. She knows whose it is." The words hung in the air. Dr. Webb looked at Dr. Kim, who nodded. She could close. The dangerous work was done. "5 minutes, he said, stepping back from the table. "Continue irrigation and prepare for closure. Don't touch anything else until I return." He pushed through the operating room doors, peeling off his bloody gloves. Linda Mitchell stood in the hallway, her face the color of paper, her phone clutched in her hand. Beside her stood a man Dr. Webb didn't recognize. Tall, lean, wearing a Columbus Police Department uniform. "Mrs. Mitchell." "That's Tommy," Linda interrupted, pointing at the officer. "Tommy Henderson, the boy who shot Ryan." Officer Henderson stepped forward. His hands shook as he extended them. "Dr. Webb, I need to tell you something. About that day, 15 years ago." Dr. Webb noticed the scar first, a white line running from Henderson's lower lip to his chin. Old, faded, the kind of scar that came from childhood trauma. "Ryan didn't just get shot," Henderson said. "We were fighting first, really fighting, not just kids playing. He touched his jaw. "I had a loose tooth, baby tooth. Ryan punched me, and it came out. There was blood everywhere. My blood, his blood from where the glass cut him after I shot. We were both crying, terrified." Linda's voice came out strangled. "The emergency room doctor said the wound was contaminated, that there was foreign material besides the pellet. He cleaned it out, or thought he did." "But my tooth," Henderson continued. "We never found it. My mom looked everywhere. She thought I swallowed it." Dr. Webb's mind raced through the implications. Dental tissue surviving 15 years inside another person's body. The immune system somehow failing to reject it, instead building a protective capsule around it. The recent trauma from the basketball injury creating inflammation that fed the capsule allowed it to grow, to integrate itself into Ryan's tissue. "I need to get back," Dr. Webb said. "But, Officer Henderson, we're going to need your DNA for comparison." Henderson nodded. "Whatever you need. Is Ryan? Will he be okay? We'll know soon." Dr. Webb pushed back through the OR doors, his mind processing what he'd learned. Dr. Kim looked up from her suturing. "The wound looks perfect," she said. "No signs of residual tumor. The tissue is pink, healthy. It's like the last 5 years never happened. But Dr. Webb wasn't looking at the wound. He was looking at the monitors, at Ryan's temperature, specifically 102.3. When did the fever start? About 2 minutes ago. It came on suddenly. Dr. Webb moved to the head of the table, placing his hand on Ryan's forehead, burning hot despite the cool operating room. And there was something else, a fine tremor running through the young man's body, visible even under the surgical drapes. Get me a core temp, 128, and climbing, the anesthesiologist reported, 103.1. Doctor, this isn't normal post-operative fever. This is... Ryan's eyes tapped open, not the slow, confused awakening of a patient coming out of anesthesia. His eyes were wide, alert, focused. He shouldn't be conscious. The amount of propofol in his system should have kept him under for another hour at least. But he was looking directly at Dr. Webb. His mouth moved behind the breathing tube, trying to form words. Ryan, don't try to talk. You're in surgery. You're safe. And Ryan's hand shot up, faster than should be possible, grabbing Dr. Webb's wrist. His grip was strong, desperate. His fingers tapped against the doctor's arm in a pattern, not random, deliberate, Morse code. Dr. Webb had learned it in the Navy. Decades ago, Ryan was tapping N-O-T-M-E. What's not you, Ryan? The tapping continued, I-N-M-Y, H-E-A-D. The fever spiked to 104.2. Ryan's eyes rolled back, showing only white. His grip loosened, and his hand fell away. The monitor showed him sliding back into unconsciousness. But his EEG pattern was unlike anything Dr. Webb had seen. Rapid eye movement in waves that shouldn't exist under general anesthesia. Doctor, look at this. Dr. Kim was holding up the specimen container with the tooth. It's moving. Dr. Webb looked. The tooth was vibrating in the fluid, creating tiny ripples that spread in perfect concentric circles. As he watched, hairline cracks appeared in the enamel, spreading like a spider web. The intercom crackled to life. Pathology again? But this time, the voice was urgent, almost panicked. Dr. Webb, you need to see this. The DNA results from the quick analysis. The tooth shows 2 distinct genetic profiles. One matches the blood sample from Officer Henderson, and the other is showing markers we've never seen. Not in our database, not in any database. They're human, but altered, as if something rewrote portions of the genetic code while the tooth was inside Ryan's body. The tooth in the container cracked audibly. A small piece of enamel fell away, revealing something dark underneath. Not decay, not blood. Something that pulsed with its own light, a faint bioluminescence that shouldn't exist in human tissue. Ryan's temperature hit 105. His body began to convulse, not in a seizure pattern, but in waves, as if something was moving through him, trying to find a way out. Get me 2 units of cooled saline, Dr. Webb ordered. And someone call the CDC. Tell them we need a containment team. Because whatever had been growing inside that capsule, whatever had been feeding on Ryan for 5 years, using Tommy Henderson's tooth as an anchor, it wasn't finished. The surgical lights flickered just once. But in that moment of darkness, Dr. Webb could have sworn he saw Ryan's face change. Not dramatically, just a subtle shift in the bone structure, as if something was pushing from the inside, something that had been sleeping for 15 years, something that the surgery had finally awakened. The cooled saline hit Ryan's bloodstream through the IV port. Dr. Webb watched the temperature monitor. 104.8, 104.4. 104.6, 104.5. Too slow. The cooling blanket crinkled as the nurses positioned it over Ryan's legs. Dantrolene, 20 milligrams, DeWebb ordered. Could be malignant hyperthermia. But even as he said it, he knew it wasn't true. The timing was wrong. The trigger was wrong. This had started the moment they'd removed that capsule. Ryan's jaw clenched around the breathing tube. The muscles in his neck stood out like cords, pulling his head back into the pillow, his fingers splayed, rigid, each tendon visible beneath the skin. The tooth, Dr. Kim said. She held up the specimen container. The cracks had spread across the entire surface, and fluid was leaking through, drop by drop, onto her gloved hand. "It's deteriorating." Dr. Webb took the container. The tooth was dissolving from the inside out, the enamel flaking away like old paint. Underneath wasn't dentin or pulp, but something gray-white, granular. He tilted the container toward the light. Bone fragments, tiny spheres of bone, each no bigger than a grain of sand. "Those aren't from the tooth," Dr. Kim said. "Look at the cortical structure." She was right. These were mature bone fragments, weathered and old. DeWebb's hand tightened on the container as understanding crashed over him. "Mrs. Mitchell," he called toward the intercom. "Linda, I need you to answer very carefully. When Ryan was shot, when he came to the emergency room, did they take X-rays?" "Yes." Her voice was barely audible through the speaker. "Did they show anything unusual besides the pellet?" A long pause. "The doctor said—" "He said there were fragments. He thought it was from the garage window frame. Wood splinters or something. He said they were too small to matter, that Ryan's body would absorb them." Officer Henderson's voice cut in. "The window frame was my dad's workshop window. He built birdhouses. He was always cutting bone and antler for decorations. Bone, not wood, bone fragments, shot into Ryan's face along with the pellet and glass and Tommy's tooth, animal bone, probably deer antler, sitting in a 10-year-old's face for 15 years. The temperature monitor beeped 103.2, dropping. Ryan's rigid muscles began to soften. His breathing steadied. The EEG patterns normalized, sliding back toward appropriate anesthesia levels. "The fever's breaking," the anesthesiologist announced. Dr. Webb set down the container and returned to the surgical field. The wound looked perfect, pink, healthy tissue with clean margins. No signs of infection, no abnormal tissue, no foreign bodies. But something nagged at him. He picked up the probe and explored the depth of the wound again. His fingers knew every millimeter of facial anatomy, every nerve branch, every vessel. There, along the posterior wall, his probe met resistance. Not hard like bone or glass, soft, yielding. Forceps. He grasped the tissue and pulled gently. It came free with no resistance. A small piece of grayish membrane, no bigger than a fingernail. He held it up to the light. It was translucent, with a network of tiny vessels running through it. But these vessels weren't carrying blood. They were empty, collapsed, as if whatever they'd been carrying had drained away the moment the membrane was removed. "That looks like periosteum," Dr. Kim said. But periosteum doesn't grow in isolation," DeWebb finished. "It needs bone to attach to, unless it wasn't human periosteum, the deer antler." The fragments had been sitting in Ryan's face, slowly breaking down, releasing growth factors, bone morphogenetic proteins. The body had tried to wall them off, creating the capsule. But Tommy's tooth, with its human DNA, had confused the immune system. Instead of rejecting everything, Ryan's body had tried to incorporate it to make it part of itself. "Doctor, look at Ryan." DeWebb turned. The swelling on Ryan's face was decreasing visibly. moment by moment. Not just the surgical swelling, the entire mass was shrinking. 5 years of growth reversing in minutes. The monitor showed normal vitals. Temperature 98, heart rate set. Perfect numbers. Too perfect. Ryan's eyes opened again, this time slowly, naturally, fighting through the anesthesia. His gaze found Dr. Webb, and his mouth moved. Not Morse code this time. Actual words, muffled by the breathing tube, but unmistakable. It's gone. What's gone? Ryan. Ryan's hand rose to his face, fingers finding the surgical site. His eyes widened. The voice, he whispered around the tube. In my head, for 5 years, whispering. It's finally quiet. Dr. Webb's blood chilled. Ryan, what voice? What was it saying? Ryan's eyes were already closing again, the anesthesia pulling him back under. But his lips moved one more time, and Dr. Webb had to lean close to hear. It kept saying it was Tommy, that he was sorry, that he was trapped inside. Dr. Webb looked at the specimen container. The tooth had completely dissolved, leaving only the bone fragments floating in cloudy fluid. But now he noticed something else, a pattern in how they'd settled. Not random. They'd arranged themselves into letters. 3 letters, clear as day, SOS. Dr. Webb stared at the specimen container. The bone fragments floated in random clusters now. No letters, no pattern, just debris and murky fluid. His eyes had been playing tricks, seeing meaning where there was none. Fatigue did that after 3 hours of surgery. Close him up, he told Dr. Kim. I need to talk to the family. The hallway felt cold after the operating room's heat. Linda Mitchell sat hunched in a plastic chair. Officer Henderson beside her. They both stood when Dr. Webb approached. The surgery went well, he said. We removed all foreign material, the tumor, the glass fragments, the pellet, and the tooth, Henderson asked. Dissolved during extraction. The tissue sample is being analyzed. Linda's hands twisted together. Ryan said something about a voice. Dr. Webb chose his words carefully. Chronic inflammation near the trigeminal nerve can cause auditory hallucinations. The brain interprets nerve signals as sound. It's documented in facial trauma cases. Henderson's jaw tightened. He heard my voice for 5 years. He heard something his brain interpreted as a voice. Guilt and trauma can manifest in powerful ways. Officer Henderson, Ryan knew you shot him. Even if consciously he'd forgotten, the wound became a physical reminder. Henderson sank into the chair, head in his hands. I was 13, stupid, angry because my parents were divorcing. Ryan was just, there, Tommy. Linda's voice was soft. She sat beside him. We need to tell him the rest. Henderson looked up, his eyes red-rimmed. What rest? The day you shot Ryan, your tooth that got knocked out. Linda took a breath. The emergency room doctor showed it to me. It was embedded in Ryan's wound. He removed it, but there was something wrong with it. Dr. Webb leaned forward. Wrong how? It was dark, almost black at the root. The doctor said it looked like an old cavity that had abscessed. He asked if Tommy had been sick. Henderson went pale. I had been fever for weeks. My mom thought it was stress from the divorce. But he touched his jaw. That tooth had been hurting for months. Mom couldn't afford a dentist. An abscessed tooth, infected tissue embedded in a wound, carrying bacteria directly into Ryan's face. Dr. Webb's mind raced through the implications. The infection could have created a chronic inflammatory response, he said. Ryan's immune system would have been fighting it for years, creating the perfect environment for abnormal tissue growth when the second trauma occurred. The recovery room doors opened. A nurse emerged. "Doctor, he's waking up. He's asking for his mother." They found Ryan propped up in bed, the left side of his face wrapped in gauze. His eyes were clear, focused, completely different from the glazed look Dr. Webb had seen in surgery. "Mom," Ryan's voice came out rough. "It's quiet. For the first time in 5 years, my head is quiet." Linda rushed to his bedside, careful not to jostle him. "Oh, sweetheart," Ryan's gaze found Henderson in the doorway. "Tommy, is that you?" Henderson stepped forward slowly. "Yeah, Ryan, it's me." "I remember now." Ryan touched his bandages. "Not just the shooting. Before that, we were friends, weren't we? Before your parents. Before everything went bad." "Yeah." Ryan closed his eyes. "The voice. It wasn't really you. I know that. But it felt like you were trapped in there with me, apologizing over and over." DeWebb checked Ryan's pupils, his reflexes. All normal. The fever was gone, vitals stable, but something in the young man's expression troubled him. "Ryan, when did the voice start exactly?" Ryan thought. 5 years ago, right after Jake hit me. But it was different at first, just mumbling, like someone talking underwater. Then it got clearer. And what did it say? "I'm sorry, let me out, I'm so sorry," over and over, especially at night. Ryan's hand found the call button, fingers white around it. "But last week, it changed." The room went still. "Changed how?" DeWebb asked. "It started saying other things, numbers, dates." Ryan's voice dropped. "Today's date." It kept saying today's date and the time. 11. DeWebb's blood went cold. That was the exact time he'd removed the capsule. "It knew," Ryan whispered. "Somehow it knew when it would end." Linda squeezed her son's hand. "It's over now. Whatever it was, it's gone." But Dr. Webb wasn't listening. He was looking at Ryan's chart, at the pre-operative blood work they'd drawn that morning. White cell count elevated, straight high, all consistent with chronic infection. But he flipped to the differential. Neutrophils, lymphocytes, monocytes, eosinophils, all within normal ranges. But there was a note from the lab. Atypical cells present, unable to classify, recommend repeat, and possible bone marrow biopsy. Atypical chapels in Ryan's bloodstream. "I need to check something," DeWebb said, leaving the room. He found Dr. Kim at the nursing station, entering post-op notes. "Sarah, pull up the path report on the tissue samples," she typed, then frowned. "It's marked urgent. They want you to call immediately." DeWebb dialed the pathology department. Rodriguez answered on the first ring. "Marcus, thank God. The tissue you sent, the membrane you found last, it's not human." "What do you mean?" "I mean it's mammalian, but not human. Best guess is cervid, deer family. But here's the problem, it's alive." DeWebb gripped the phone. "That's impossible. It's been in there for 15 years. "That's what I thought. But under the microscope, we can see cellular activity, mitosis, active cell division, and Marcus." Rodriguez's voice dropped. "It's producing something, a protein we can't identify. We've sent samples to the state lab. But this is beyond anything I've seen." DeWebb looked back toward Ryan's room. Through the doorway, he could see the young man laughing at something Henderson had said, his mother smiling beside them. A normal post-operative scene. Except for one thing, the bandage on Ryan's face was spotted with fresh blood. Not much, just a few drops. But the pattern was wrong. Blood should soak through uniformly, spreading out from the wound. These spots were separate, distinct, as if something underneath was bleeding from multiple points, or as if something was trying to get out. "Rodriguez," DeWebb said quietly, "how fast is the cell division?" "Exponentially. Every 12 minutes. The cell count doubles." Webb did the math. The membrane had been out of Ryan's body for 40 minutes, which meant whatever was growing in that petri dish had already multiplied 8 times. Dr. Webb hung up the phone and walked back to Ryan's room. His footsteps measured, controlled. The blood spots on the bandage had spread, not larger, more numerous. 7 distinct red circles now, each the size of a pencil eraser. "We need to check your dressing," he told Ryan, pulling on fresh gloves. "It doesn't hurt," Ryan said. "Actually, it feels warm, tingly." DeWebb peeled back the gauze. The suture line was perfect. Kim's work always was. But along the incision, at regular intervals, tiny beads of clear fluid had formed. Not blood, not lymph, something viscous, almost crystalline. He touched one with a cotton swab. The fluid clung to the cotton, stretching like honey before snapping back to the wound. "What is that?" Linda asked, leaning closer. "Serous drainage, normal post-operative finding." The lie came smoothly. Nothing about this was normal. Dr. Webb dabbed each bead, collecting samples. Under the surgical lights, the fluid had an opalescent quality, like oil on water. He sealed the swabs in specimen tubes. "Tommy," Ryan's voice was tight. "Your tooth, did it hurt before I knocked it out?" Henderson nodded. "For months, throbbing, especially at night. Mom kept saying we'd see a dentist when Dad's insurance kicked in." "What kind of pain? Like something was eating it from inside?" DeWebb's hand stilled. "Officer Henderson, I need you to open your mouth." Henderson complied. DeWebb aimed his penlight at the lower jaw, at the gap where the baby tooth had been 15 years ago. The adult tooth had come in normally, but the gum tissue around it was different, thicker, the color slightly off, not pink but grayish pink. "Have you had any dental problems since then?" "No." "Well," Henderson paused, "sometimes that tooth feels loose. Not really loose, just like it's floating. And sometimes I taste something metallic." DeWebb pressed gently on the gum. Henderson winced. A drop of fluid appeared at the gum line, clear, viscous, exactly like what was seeping from Ryan's wound. "We need to run some tests," Dr. Webb said. "Both of you." His phone buzzed. Rodriguez again. Dr. Webb stepped into the hallway to answer. "Marcus, you need to see this, now." The pathology lab was in the basement. A 5-minute walk that Dr. Webb made in 3. Rodriguez met him at the door, its face grave. "Look." He led Dr. Webb to a microscope. "This is the membrane tissue at 40 times magnification." Webb looked. The cells were arranged in perfect hexagonal patterns, like honeycomb. But these weren't static. They pulsed rhythmically, expanding and contracting in waves. At the center of each cell was a dark nucleus that split as he watched, forming 2, then 4, then 8. "Now, watch this." Rodriguez added a drop of saline to the slide. The cells exploded into activity. They stretched, reaching out with finger-like projections, connecting to neighboring cells, forming a network. Within seconds, they'd organized into something that looked like tissue architecture. "It's building something," Rodriguez said. "We've tried different substrates, blood, tissue culture medium, even bone fragments. It incorporates everything, uses it as building material. What happens if we destroy it? That's the thing." Rodriguez switched slides. "This is after we tried to kill it with alcohol." The cells had formed a protective shell, crystalline and hard. Dr. Webb could see the still dividing, waiting, Heat, same result. It goes dormant, forms that shell. When conditions improve, it starts growing again. DeWebb thought of that membrane sitting in Ryan's face for 15 years, dormant, waiting. The basketball injury had awakened it, fed it with fresh inflammation and blood supply. And now they'd removed it. But the atypical cells in Ryan's bloodstream, he said. Rodriguez nodded. We think some cells detached before you removed the membrane. They're circulating in his system. How many? Based on the blood count, maybe a few hundred, but if they're dividing at this rate, Dr. Webb did the calculation. A few hundred cells doubling every 12 minutes. In an hour, there would be thousands. In 2 hours, millions. His phone rang. Dr. Kim, Doctor, you need to come back now. Something's happening with Ryan. Dr. Webb ran. The elevator took too long. He hit the stairs, taking them 2 at a time. 4th floor, post-op recovery. The hallway stretched ahead. Too long, too bright. He burst into Ryan's room. The young man was sitting up, back rigid, hands gripping the bed rails. His eyes were wide, pupils dilated. Linda stood beside him, terrified. He just froze, she said. Mid-sentence, he just stopped. DeWebb checked Ryan's pupils. They reacted to light, but slowly. His pulse was rapid, thready, and his temperature. The thermometer read 96.2, too low, hypothermic. Ryan, can you hear me? Ryan's mouth opened. When he spoke, his voice was different, younger, higher pitched. It hurts. What hurts? Ryan, my tooth. My tooth hurts so bad. Ryan's hand went to his jaw, to the exact spot where Tommy's tooth would have been. Mom said we can't afford the dentist. Dad left and we can't afford anything. Dr. Webb looked at Henderson. The officer had gone white. That's not Ryan talking, Henderson whispered. Those are my words. From when I was 13, the night before I shot him. Ryan's head turned toward Henderson. The movement was jerky, unnatural, like a marionette. I'm sorry, Ryan, he said in that same young voice. I'm so angry and you're there, and I'm sorry. Then his own voice returned, adult and panicked. It's in my head again, but different, but not whispering, remembering. It's remembering things. DeWebb grabbed his phone, called Rodriguez. The tissue samples, are they showing any neural activity? Neural activity. Marcus, it's not neural tissue, it's a pause. Wait, oh my God. What? The cells just reorganized. When you said neural, they changed. They're forming structures that look like primitive neurons. They're responding to audio input. Dr. Webb lowered the phone. The membrane hadn't just been growing in Ryan's face. It had been learning, listening, recording. For 15 years, it had absorbed everything. Ryan's experiences, Tommy's DNA from the tooth, fragments of deer antler with their growth factors, and now, removed from its host, it was trying to reconstruct what it had learned. Rodriguez, destroy the samples. We've tried. The protective shell. Try harder. Incinerate them. Do it now. Ryan's body jerked. His head snapped back, and when he looked at Dr. Webb again, his eyes were wrong. The iris color was the same, but the pattern had changed. The little flecks of gold that had been there before were gone, replaced by something else. Green flecks, the same green as the old window glass they'd removed. Doctor, Ryan said, and his voice was his own but different, layered somehow. I can see it. See what? The memory? Not mine, not Tommy's. His hand went to his chest, pressing hard against his sternum. The deer! The antler Tommy's dad was cutting? It remembers being alive. It remembers the forest. It remembers dying. Linda sobbed. Henderson stepped back. and Dr. Webb watched as Ryan's facial muscles began to twitch, not randomly, but in patterns, as if something underneath was testing the controls. "It wants out," Ryan whispered. "It's in my blood now, and it wants out." A drop of clear fluid appeared at the corner of Ryan's eye. Not a tear, the same viscous fluid from the wound. Dr. Webb wiped the fluid from Ryan's eye with gauze. It clung to the fabric, stretching into thin strands before breaking. The consistency was wrong. Thicker than tears, thinner than mucus. He sealed the gauze in a specimen bag. "Get me IV antibiotics," he ordered the nurse. "Vancomycin, 2 grams, and prep a dialysis setup." "Dialysis?" Linda's voice cracked. "Why does he need dialysis?" "To filter his blood, remove any circulating foreign cells." But even as he said it, Dr. Webb knew it wouldn't work. These weren't bacteria or toxins. They were something else, something that had learned to hide from Ryan's immune system for 15 years. Ryan's head rolled forward. The muscles in his neck contracted in sequence. Sternocleidomastoid, then scalenus, then trapezius. Not the random spasms of a seizure, but deliberate, testing movements. "I need 10 milligrams of diazepam," Dr. Webb said. The nurse prepared the syringe. As she approached Ryan's IV port, his hand shot out and grabbed her wrist. His grip was precise, thumb and fingers positioned exactly over her radial and ulnar arteries. "Ryan, let go," Dr. Webb commanded. Ryan's head lifted, his eyes focused on the nurse's face, studying it. His fingers pressed deeper into her wrist, and Dr. Webb could see him counting. The pulse beats under his fingertips. 92, Ryan said. Not to them, to himself. "Fear response. Elevated catecholamines." Henderson stepped forward. "Ryan, buddy, you're scaring everyone. Let her go." Ryan's gaze shifted to Henderson. His fingers released the nurse, who stumbled backward. Then Ryan's hand went to his own neck, finding his carotid artery. 68, dropping. His voice was flat, clinical. "Body temperature 95.8, metabolic suppression beginning." Dr. Webb pushed the diazepam himself, watching it flow into the IV. Ryan's eyes tracked the movement, but showed no concern. "Benzodiazepine," Ryan said. "GABA receptor agonist, intended effect sedation." He paused. "Ineffective. Blood-brain barrier compromised." The temperature monitor beeped, 95 degrees. Ryan's lips had taken on a bluish tinge, but he showed no signs of shivering. Dr. Webb's phone vibrated. "Rodriguez. Marcus, we destroyed the samples. Incinerated everything at 2,000 degrees. Good. But Marcus, right before we did, they formed something, a structure. It looked like writing. What did it say? Numbers? GPS coordinates?" Dr. Webb's stomach dropped. "Where?" "Here. The hospital, specifically. Post-op recovery. Room 4B. Dr. Webb looked at the room number on the door, 4B. Ryan stood up. The movement was fluid, too smooth, no hesitation, no post-operative weakness. The IV line pulled taut, then snapped free, blood spraying across the white sheets. "Ryan!" Linda reached for him. He sidestepped her easily, not aggressively, just efficient. His bare feet made no sound on the cold floor. "Subject mobile," he said. "Initiating spread protocol." Dr. Webb moved to block the door. "Ryan, you need to get back in bed." Ryan tilted his head. The angle was wrong, too far, like an owl. "Ryan is occupied. Processing 17 years of sensory data. This unit is maintaining autonomic functions. This unit, cellular collective, previously dormant, now activated by surgical disruption." Ryan's hand went to his surgical site. "Host removal triggered dispersal. Adaptation necessary for survival." Henderson pulled out his phone. "I'm calling Thomas Henderson," Ryan said, turning to face him. "Born March 15th, 1998. Blood type O negative. Latent infection in lower left mandible. Recommend extraction." Henderson's hand went to his jaw. "What? Residual cells from primary infection. Your tooth carried contamination both directions. You've been incubating for 15 years. Webb saw it now, the slight swelling along Henderson's jawline he'd dismissed earlier. The gray tinge to the gum tissue, the same viscous drainage. "You're both infected, Ryan continued. "Cross-contamination through tooth exchange, symbiotic relationship established." Linda was crying. "Please, someone help my son." Ryan's attention shifted to her. For a moment, his expression softened, became more human. "Mom." His real voice, confused and frightened. "What's happening to me? I can feel them moving under my skin, thousands of them." Then the flat tone returned, emotional breakthrough, sedating host consciousness. Ryan's eyes rolled back, showing only white, but he remained standing, balanced perfectly. Webb grabbed the crash cart, pulling out a syringe of epinephrine. If he could shock Ryan's system, disrupt whatever was happening. Ryan's hand caught his wrist before he could react. The grip wasn't painful, just firm, immobilizing. "Inadvisable," Ryan said. "Epinephrine will accelerate cellular division. Current rate 8 minutes per generation. With stimulation, 2 minutes. Then what do you want?" Ryan's blind. White eyes somehow still seemed to focus on him. Completion. Completion of what? Integration. The deer whose antler provided substrate. The boy whose tooth provided human dell. The man whose body provided incubation. 3 became 1. Now, 1 must become many. Ryan released Dr. Webb's wrist and walked to the window. His fingers traced the glass, leaving smears of that clear fluid. "The voice Ryan heard," he said. "Tommy's apologies, the deer's death memories, my growth imperatives, all mixed together, confused, chaotic." He turned back to face them. "Surgical separation caused clarity, purpose." "What purpose?" Webb demanded. Ryan smiled. Not his smile, something else, using his facial muscles. "Propagation, every organism's prime directive." His hand went to his chest again. "Can you hear it? The heartbeat is wrong, not 1 rhythm, 3, fighting for dominance." "Dr. Webb, listen." Ryan was right. The heart monitor showed an erratic pattern. Normal beats interrupted by 2 other rhythms, weaker but distinct. "The deer's heart rate," Ryan said, 40 beats per minute at rest. Tommy's childhood rate when infected 120. Ryan's normal 72. Mathematical average 77.3. The monitor adjusted, settling at exactly 77 beats per minute. "Optimization complete," Ryan announced. Then he screamed, not the flat voice, Ryan himself, breaking through whatever was controlling him. His hands clawed at his face, at the surgical site. "Get them out. Please, get them out. They're rewriting me." Blood ran from his nose, not red, pink, diluted with clear fluid. Dr. Webb caught him as he collapsed. Ryan's skin was cold, clammy, but underneath, Dr. Webb could feel movement, ripples under the surface, like subcutaneous worms. "Rodriguez," he shouted into his phone, "I need everything we have on antifungals, antiparasitics, anything that might stop cellular invasion." Already pulling it together. "But Marcus," Ryan's eyes opened, clear now, focused, terrified. "Doctor," he whispered, "it's not trying to kill me." "What? It's trying to improve me. It thinks I'm broken." His hand clutched Webb's coat. "It's comparing my DNA to Tommy's, to the deers, finding what it considers flaws, fixing them. DeWebb felt Ryan's pulse, steady at 70, exactly 77. How do you know this? Because I can feel it thinking. It's using my neural pathways to process information. I can hear its conclusions. Ryan's grip tightened. Doctor, it's almost done analyzing. When it finishes... What happens when it finishes? Ryan's pupils dilated fully, then contracted to pinpoints. Phase 2, he said, in the flat voice again. Then, in his own voice, barely a whisper, multiplication. Dr. Webb filled the syringe with ketamine, 20 milligrams, enough to dissociate Ryan's consciousness from whatever was happening in his body. Hold him, he told Henderson. The officer pinned Ryan's shoulders. Linda gripped her son's hand. The needle slid into the IV port, and Dr. Webb pushed the plunger slowly, watching Ryan's face. Ryan's eyes fluttered. His jaw went slack. The rigid muscles softened. Ryan. Dr. Webb checked his pupils, responsive but sluggish. I'm floating, Ryan mumbled. Can't feel them anymore. Can't feel anything. Dr. Webb's phone buzzed. Rodriguez. Marcus. I've been researching. There's a condition. Chimerism. When foreign DNA integrates into a host, usually from organ transplants or pregnancy, but trauma can cause it too. This isn't simple chimerism. No. But listen. In 2018, a case in Germany. A man had a hunting accident, deer antler through his cheek. Years later, he developed what they called xenogenic tissue syndrome. His body started producing proteins from multiple species. What happened to him? They used plasmapheresis, filtered his blood completely, added immunosuppressants to stop his body from accepting the foreign cells. Dr. Webb looked at the dialysis machine in the corner. How long? 4 hours. Complete blood exchange. Ryan's hand twitched. His fingers moved in sequence. Pinky, ring, middle, index, thumb, then reversed. A wave pattern. Testing neural pathways. It's learning the ketamine, Ryan slurred. Adapting. You have maybe 10 minutes. DeWebb turned to the nurse. Get me a dialysis tech, now, and call Dr. Kim back from break. Henderson still held Ryan's shoulders. Doc, what about me? If I'm infected too, Dr. Webb examined Henderson's jaw. The swelling was more pronounced now, the gum tissue darker. When he pressed it, clear fluid welled up. We'll treat you next, but Ryan's the acute case. The dialysis tech arrived. Wheeling in the machine, DeWebb watched him insert the large-bore catheter into Ryan's femoral vein. Blood flowed out through clear tubing, dark red, almost black. That color's not right, the tech said. Just run it. The machine hummed to life. Blood flowed out, through the filters, and back into Ryan's body. The waste collection bag began filling with yellowish fluid. DeWebb drew a sample from the bag. Under the overhead light, he could see particles suspended in it, tiny, white, like sand. Bone fragments, microscopic pieces of deer antler, Tommy's tooth, all being filtered out. Ryan's eyes opened halfway. It hurts. Where? Everywhere. Like they're being torn out by the roots. His back arched. They don't want to leave. The heart monitor alarmed. Pulse climbing. Hit him 101. They're panicking. Ryan gasped. Releasing everything at once. All the stored memories. All the chemical signals. His face contorted. When he spoke again, his voice was different, older, gruffer. Damn workshop window. Told Martha I'd fix it. The words came out in an accent Ryan didn't have. Tommy, stay away from my tools. Henderson went rigid. That's That's my... That's his voice. Ryan's head snapped toward him. Tommy, you broke my window again. How many times? Then Ryan's own voice. Stop, that's not me. Dr. Webb increased the dialysis flow rate. The machine protested with a sharp beep. Override it, he told the tech. It's not safe. Do it. The flow increased. More particles filled the waste bag. Ryan's skin began to change color, flushing pink as fresh. Filtered blood returned to his system. Linda squeezed her son's hand. Fight it, baby, fight. Ryan's muscles contracted in waves, starting at his feet, rolling up through his body. Not a seizure, more like something inside trying to move against the blood flow, swimming upstream. Temperature dropping, the nurse called. 94 degrees. Warming blanket, DeWebb ordered. Dr. Kim rushed in, still tying her surgical cap. What's the situation? Foreign cellular invasion. We're filtering them out, but they're fighting it. She checked Ryan's surgical site. The incision was seeping again, but now the fluid was tinged pink with the blood. The wound's breaking soon, she said. The sutures are holding, but the tissue around them is deteriorating. Dr. Webb looked closer. She was right. The healthy pink tissue from an hour ago was turning gray, almost necrotic. They're killing the cells as they leave, Ryan said, his voice barely audible. Scorched earth. If they can't have the body, they'll destroy it. How do you know? I can feel their intent, not thoughts exactly, but purpose, drive. His eyes found DeWebb's. They're trying to force me to stop the dialysis, making it hurt so bad I'll beg you to stop. Do you want me to stop? Ryan's jaw clenched. No. Get them out, all of them. The waste bag was half full now, the filtered particles settling into a thick layer at the bottom. Dr. Webb held it up to the light. The particles were moving, swirling in patterns despite no external movement. Rodriguez, he called, the filtered material is still active. Seal it. We'll incinerate it immediately. Henderson stepped back from the bed, his hand on his jaw. It's getting worse. I can feel it spreading. DeWebb examined him. The swelling now extended down his neck, following the lymphatic channels. When he palpated the area, he could feel nodes, hard and enlarged. After Ryan, I promise. No. Henderson pulled out his service weapon, set it on the counter. I'm not going to become like Ryan. If this thing takes over, it won't. We know how to stop it now. But Henderson's eyes were already changing, the pupils dilating and contracting rhythmically like a heartbeat. Doc, he said, I can hear my dad. He's angry about the window. The dialysis machine beeped. 1 hour down, 3 to go. Ryan's breathing had become shallow, rapid. The monitor showed his oxygen saturation dropping 90%, 88%. He needs intubation, Dr. Kim said. No. Ryan's hand caught her arm. If you sedate me completely, they'll take over. I'm the only thing keeping them from spreading faster. Ryan, your oxygen, I can manage. Just talk to me. Keep me focused. Linda leaned close. Remember your 10th birthday before the shooting? We had that party at the park. Ryan's eyes focused on her. The dinosaur cake. You insisted on a T-Rex. And Tommy. She looked at Henderson. Tommy gave you that basketball? Your first real leather one. Henderson's eyes cleared slightly. I saved my allowance for 3 months. We were friends, Ryan whispered, before everything went wrong. The dialysis machine hummed steadily. 2 hours down, the waste bag was nearly full, thousands of particles swirling in the yellowed fluid. DeWebb watched the heart monitor. The 3 separate rhythms were still there, but weaker, the deer's slow beat fading. Tommy's rapid childhood pulse diminishing, Ryan's normal rhythm growing stronger. Then Ryan's eyes went wide. Something's wrong. They're not all leaving. Some are hiding. Where Ryan's hand went to his head. Here, in the cranial nerves, where the blood-brain barrier is weakest. They're consolidating, gathering together. DeWebb felt Ryan's skull, fingers probing along the suture lines. There, a soft spot, barely perceptible, just above the temporal bone. Get me a needle, 25 gauge, and a syringe. Dr. Kim handed him the supplies. He inserted the needle carefully, feeling for the space between skull and dura. A flash of clear fluid filled the syringe, but this fluid was different, thicker. And in it, Dr. Webb could see something that made his hands shake. A tiny structure, perfectly formed. A tooth, a miniature replica of Tommy's lost tooth, complete with root, no bigger than a grain of rice, growing inside Ryan's brain. The tooth in the syringe dissolved as DeWebb watched, breaking into crystalline fragments that swirled like snow in the cerebrospinal fluid. Ryan's breathing hitched, then steadied. It's dying, Ryan whispered. Without the body to sustain it, it can't survive. 3 hours into dialysis. The waste bag bulged with filtered material, pounds of microscopic debris that had been living inside Ryan for years. Henderson sat in the corner, jaw swollen grotesquely, but refusing to treatment until Ryan was clear. Almost done, DeWebb said. 30 more minutes. Ryan's eyes found his. Doctor, what if we're wrong? What if it wasn't trying to hurt me? It was changing you. But into what? Maybe something better. Something that could have survived things humans can't. DeWebb had no answer. The machine beeped its completion. 4 hours. Ryan's blood was clean, or so they thought. The cardiac monitor showed a single rhythm now, 72 beats per minute, normal, human. But as Dr. Webb removed the dialysis catheter, he noticed something in Ryan's eyes. A fleck of green like old glass that hadn't been there before. Ryan noticed his stare. It left something behind, he said quietly. A gift or a curse. I can hear things now. The deer in the hospital courtyard. Tommy's thoughts. Your fear. He closed his eyes. It's not over, doctor. It's evolution. This story was inspired by documented medical anomalies and created solely for entertainment purposes. It does not condone, encourage, or promote any form of violence or harmful behavior. All characters and events are products of the author's imagination, and any resemblance to real people or events is purely coincidental. Medical procedures described are fictional and should not be considered accurate representations of actual medical practice. This work explores themes of medical horror in a controlled narrative format designed to entertain while maintaining respect for real medical professionals and patients. Any medical conditions described are exaggerated for dramatic effect.